My name is Jessie Ace. I'm part of a group of enabled warriors that you've probably never heard of. We're fighting back against our invisible illness and taking the dis out of disability. We don't give sympathy to our symptoms. They enable us to be the warrior that we are. If you ask doctors and nurses, they'd say what we're doing is impossible. But pushing the limits of our conditions is something that we have to break through every single day. See, we push the limits. We are mentally strong, and we can do anything. The question is, how far can we push those limits? This podcast will give you the answers. I'm Jessie Ace, and this is the Disabled to Enabled podcast. Enabled Warriors, on our show today is a 35-year-old obstetrician and gynaecologist based at the Causeway Hospital in Coleraine, Northern Ireland. In 2015, he was busy working in his antenatal clinic and he noticed that his eye was starting to feel like it was bruised. After being sent to the opticians, he was told everything was fine and so went back to work as normal. But then more symptoms started appearing, and being a doctor, he leaped into action, obviously, and dived into an MRI machine via A&E. The test confirmed what he thought, multiple sclerosis, but that didn't stop him. After finding the work of George Jelinek Overcoming MS program, he went straight in, changing his diet and lifestyle habits and adopting that program. He's since become a medical advisor for the OMS program and does regular fundraising for them in between doing shifts in the hospital, of course. Enabled Warriors, please help me in welcoming the amazing Jonathan White, everybody. Woo! Hey, how are you doing, Jonathan? Welcome to the show.
Hi, Jessie. Thank you very much for having me, for that very glowing introduction. I'm very pleased to be here.
Awesome. So let's get straight in by discussing what happened that day when everything kind of hit the fan, because your first symptom came completely out of the blue and you started to feel like your eye was bruised. I've not heard of that before.
Yes.
Kind of like you've been punched. Can you tell us about that?
Yeah, absolutely. So I was in a really busy antenatal clinic in an area, a very deprived area of North Belfast, and all of a sudden I just felt sort of a vague pain, like a dull ache, and the only way I can describe it would be as if I'd been punched or bruised in the eye. And it was much worse when I moved my eye a certain direction, and I was aware maybe just a very slight change in the colour of my vision, but not really, the acuity or how well I could see. And all of those things are actually quite commonly described in what I had, which is optic neuritis. But I went to my optician and said, I think I need a stronger contact lens, although I think, if I'm honest, I probably knew I didn't need a new contact lens. And they checked everything and said, no, everything needs to be fine. Don't worry too much about it. So, I mean, I think if I'm being completely truthful, I knew there was something more to it, but I very much put it into the denial box and closed it tight and went back to real life, I suppose. But and that gradually did get better over about maybe 2 to 3 weeks. But I think probably a month after that, then I was at a friend's wedding in a really nice, beautiful part of Northern Ireland called Strangford Lough. And I was sitting during the ceremony, and I noticed that when I bent my neck, I had this really intense buzzing, sort of like phones ringing in my pockets from about the belly button down. I thought, that really is not good. That can't be normal. I've got to do something about this. So as you said, I went down to my local A&E and said, I think I've got MS. Can I have an MRI, please? So they very kindly agreed to that. And I was in the MRI machine, or the electric coffin, as I like to call it. And I'm not a huge fan of them, if I'm honest.
I don't think anybody is. I mean, it's not the nicest thing.
It's not fun. And you start to hear voices in the buzzing of the magnets and things. It's all a bit freaky. But so I had my MRI, and I was seen by the neurologist, and they said, yeah, there's some inflammatory lesions in your brain and your spinal cord. It could be MS, 50-50. We'll scan you again in 6 weeks. If there's more activity on the scan, then that makes the diagnosis, and that would enable you to be eligible for treatment. And that's where it all started, really.
Wow. So in that 6 weeks then, scary time, or was that a kind of rational doctor head kind of coming out going, right, okay, this is what it is, that's fine, let's make a plan type thing?
I think you can be as rational and as doctory as you like, but being faced with the potential diagnosis of multiple sclerosis, which is an incurable chronic progressive neurological disorder, I certainly was scared, and I had fear, and there was an element of sort of, well, we don't know anything yet. Let's just wait and see.
Mm.
I certainly had the feeling that it was going to be MS. And weird how these things happen. The night before I went to get my diagnosis, I was watching TV. And I'm a really big fan of Grand Designs. You know, the show
I love that show. Yeah.
show. And the guy who was the subject of that week's show had MS. And I thought, that's it. I know it. I just knew it. It was a very, very scary time.
I can imagine, yeah. And I mean, it is kind of for anybody, but I mean, being a doctor as well, it must have been difficult kind of thinking, well, I've now got to go and be in this busy hospital and, you know, kind of talk to other people about that sort of thing. And it must be quite strange knowing that it's all going on in you,
Yeah,
would you say?
absolutely. And so, in a way, the decision was made for me. So I was told not to work. And in fact, I was actually off work for over 2 years after my diagnosis because, you know, I was working as a surgeon essentially before I became unwell. And I had a lot of sort of dizziness and balance issues. I had cognitive problems. I wasn't capable of looking after people. And I remember a really good friend of mine said at the time, you can't care for other people until you care for yourself. And I sort of had to embody that very begrudgingly, that I was not able to look after other people until I had me right.
Yeah.
So yes, it was difficult, and it was probably more difficult for my wife because she is also an obstetrician and gynaecologist. We're very boring. We met over a cesarean section, literally. But yeah, we did in the hospital that I now work in. So she was the one who was having to go and saying, well, where's Jonny? Why is he not here? I'd never had a day off sick in my life, and we decided really early on that we were just going to be honest. Because it wasn't hard for me sitting at home. It was harder for her having to lie to people continually, and she never did. She's incapable of lying, actually. So she, Jenny was very upfront, and we said, this is what this is. And I really think that helped to ease the burden for both of us, actually. It's an extra thing to have to deal with. It was there, and you know, I continue to be very open with all people I work with, and even some patients if it's appropriate to tell them about my diagnosis. I suppose the odd bad day, you know, where I feel a bit foggy or whatever, and I know it can happen to anybody, but it's always much worse when you think it could be something impending with your MS. But yeah, there is that, and I have to be mindful of how I, you know, take on work and stress and load and things. And yes, there is still that slight stigma attached. Most people see that, touch wood, 4 years down the line and I'm better than ever. But there is definitely you tell them they've got MS and they do that. Oh,
and that is the worst.
Head tilt. Yeah, absolutely. I can't stand pity. It makes me really uncomfortable towards me. So yeah, that can be difficult because there's a lot of people you work with who think they know what MS is. Believe it or not, there are many, many doctors out there who do not know anything about MS.
Oh, believe me, I know.
Yeah,
I've met a lot.
It's one that don't work in neurology. So lots of the people I work with don't have a clue about MS. That you know, they know about the MS that they read in a textbook 10, 15, 20, 25 years ago. It's a very different condition.
It's changed a lot since then as well.
Absolutely. You know, the natural history of the condition has changed. It seems to be getting less severe on its own without treatment anyway. We're not entirely sure why that's happening, but the treatments, as you say, have got significantly better. Much more about sort of the other things you can do in your lifestyle that may affect it. So yes, I spend a lot of my time re-educating people about what MS isn't as much as what it is or it can be.
Yeah, totally. And I think it's really hard to tell people and to explain everything, and because sometimes I think, I don't know about you, but to me the symptoms kind of just feel normal now, and I actually forget that like regular healthy people don't have those symptoms.
Yes, my new normal. Yeah.
Sorry?
My new normal is what I've heard it called.
Yes.
You know, and they just become aware of it. And yeah, absolutely.
Yeah.
But
so people ask you about your symptoms, and you're like, I don't know really. You just forget everything.
Yeah.
Really
or if you try to describe it and you don't do it justice, they don't understand. You know, fatigue. Oh yeah, no, I'm really tired, and I'm like, well, actually, fatigue is to me a combination of jet lag, the flu, and a hangover at the same time.
Yes.
And it's not feeling tired. It's not having a little rest will make me feel better. That sort of thing. Yeah. So
Yeah, and it drives me mad when people kind of come out with the helpful advice that they think is helping, and their heart's in the right place, but it's like, yeah, coffee isn't going to get rid of it this time.
yeah,
Like, that's not how it works.
yeah.
So yeah, interesting. So what kind of symptoms do you have, like day to day, and how do you kind of manage them with living,
So
working, in a really busy hospital?
yeah. So fortunately now I'm touch wood. I'm really lucky. A lot of the symptoms I had at the start, all the dizziness, the balance issues, which are really difficult to deal with, as well as the sort of the buzzing and the sensory stuff that I had at the start, that's all pretty much completely resolved now.
That's good.
If I am run down or I'm particularly stressed or tired, that's sort of a good friend of mine said everything gets a bit impressionist. Sort of, everything becomes a bit blurry and you can't quite think. It's almost as if there's
Yeah.
clouds in your brain or mashed potato or something. You're looking through a foggy mirror. I maybe get that a little bit, and I have some pain issues in my legs at times, and my lower back. I don't know how much of that is MS, how much of it is in my mid-30s. But, but fortunately, generally, I keep really, really well.
This is the other thing, isn't it? It's like what part of it is MS and what part of it is just me getting older? Because I've had a lot of that as well. It's
Absolutely. And
so
at the start, it can be really difficult to say, is this a bad day with MS? Is this relapse? Is this nothing to do with anything? Is it all in my head?
Do I just genuinely have a cold? Like, I don't know anymore.
Can I just have a cold or is it a relapse? Yeah, absolutely.
Exactly, yeah. The amount of times I rang my nurse when I was first diagnosed and I was like, look, I don't know if this is just me being weird. I don't know if this is MS, but what is this? Help. Help. And you must get that quite a lot, surely, as doctors and nurses.
Yeah, all the time. All the time.
Do you actually get people like, do you get friends kind of wanting a diagnosis there and then when they come to meet you sometimes? If you go out for a drink or something, you're like, yeah, I've had this thing.
With this spot diagnosis?
Do you have that a lot?
Yeah, so when you first qualify and you know a little about lots of general things, people love doing that and you quite enjoy it because sometimes you'll know the word or the name or the test.
Yeah, to show off a little bit.
To be honest, having not done general medicine for almost 10 years, I'm only of any use to you when it comes to gynaecology, and there's not many people want to talk about that.
No.
So no, I tend to avoid it. Although I do now get a lot of questions about MS and my MS from friends and people, and lots of questions like, "Do you think this might work for me with this condition and this?" Yeah, so I still get a bit of it, but much less because I'm involved in a profession that some people think is gross, as I've heard said before.
Really?
Yeah, believe it or not, yeah, absolutely. And so they might not want to talk over a drink or dinner.
No, well, that's quite kind of a good thing, I suppose. So how did you first get into being like a gynaecologist and obstetrician? Like, what was the thing that first attracted you to it?
So when I was at medical school, in your last 2 years, you did these 5-week clinical attachments. So you were based on the ground in the hospital, on the wards, following the doctors and seeing what the specialties were about. Mm-hmm. And that 5-week block, and I was in gynae for me, I studied in Glasgow University in Scotland. So I was attached to sort of area between Falkirk and Stirling. And I was just very, very lucky to be attached to a really phenomenally inspirational consultant, Dr. Hilary McPherson, who's now just retired actually. And she absolutely lit my fire for that subject. I just thought, absolutely. And I knew nothing about it because you have no exposure to it before that in any of your other training. And I love the mix of medicine. I love the mix of surgery. I like the fact that there was little subspecialties within it, that any day was very likely to be different. It wasn't just, with all due respect, sitting in a GP surgery, which I would find very difficult all day. I got to use my hands. I got to think. I find pregnancy absolutely fascinating. The miracle it is growing something inside another human in 9 months. If it was a cancer growing that fast, it would kill you in 9 months. Yeah. How do the two bodies work together to achieve this incredible goal? The miracle it is conception, and I still absolutely love that. I still find it fascinating. And I'm really, really fortunate to be able to work in that specialty because I do still love it, and it's a real privilege actually to sort of help these women through these massive phases and changes in their life.
Yeah, I mean, it must be amazing supporting a woman from through her pregnancy journey.
Yeah,
Crazy.
so a lot of the work I do now is in early pregnancy and specifically in recurrent pregnancy loss. So these are couples who have had 3 or more losses in the first
Oh,
trimester usually. And as you can imagine, that's very difficult emotionally,
heartbreaking.
of course. And the clinic is designed, it's set up to be dedicated to have support from that aspect, as well as the
Mm.
test things that we do and the treatments that we offer. But a, a big part of that is when they do become pregnant again, it's been shown that um, what we call surveillance scanning, so repeated scanning early on, can really change the outcome and essentially take home more live babies, which is what everybody wants, of course. So it's a real privilege because I get to really know these people. I see them maybe 5, 6 times between the clinic and the early pregnancy, and then I follow them through the whole antenatal course and sometimes even deliver their baby, which is just absolutely phenomenal to be able to do.
Wow.
It really is. It's a huge responsibility. I know that, but it really truly is a privilege.
That's amazing. That really is. And especially amazing that you met your wife doing that as well.
Yeah.
That's insane.
Yeah, the chat over the dinner table is pretty boring, I have to say. Um, yeah, it is. It's one of those things where fate conspires against you. You know, I wasn't supposed to go to that hospital that year, but
Oh,
I
no
heard
way.
last minute, and I was cross about it because I'd already been there before and I didn't want to do it again. And and on the first day, that's when I met my future wife. And it's a unit that I worked in that ultimately I made friendships and professional relationships that offered me the job that I now have now. so
How crazy is that?
so
That's
yeah,
insane.
it is crazy. Absolutely.
That's amazing.
It's a
So,
gift.
so what would you say is the biggest thing that you've learned since being diagnosed? Would you say?
Um, I suppose it would probably be the importance and the power of patience and being patient. Like this is a lifelong, it's an incurable chronic illness, and it's been said that it has more effect on you than any other chronic illness. In fact, specifically MS. And as I'm sure you know, Jesse, as well as I do, there are good days. I don't know if they are good compared to life before MS. They might be even better, but there are certainly a lot of bad days, and it really is, riding a storm at times, and sailing a boat over a rocky sea, um, and knowing that this is a hard fought victory that doesn't come overnight.
Oh,
You know,
totally. Yeah.
I was diagnosed over 4 years ago. Am I completely normal, inverted commas? No, I'm not. Still, am I hundreds and hundreds of percent better than I was when I was first diagnosed? Absolutely, yes, I was. And do I still have days that are not so good? Yes, I do. But I know that the day after might be even better. So
Totally. Yeah.
patience for me was hard to learn. I'm not a very patient person, and I'm still not a very patient person at times. I want everything fixed there and then, but I think yeah, the patience and the humility that comes with it has been the single hardest thing for me to learn, I think.
You think so? Yeah. And I bet you've had to learn a lot of more. I bet you've had a lot more empathy for patients and what they're going through. 'Cause you can probably relate a lot more. Do you say?
Yeah, do you know what? People ask me this quite a lot, and I've come to realize that I am a far better doctor than I was before I was diagnosed with MS, without a
That's amazing.
without a shadow of a doubt. Because and you could probably argue that I wasn't very good to start off with, but coming from the point of view that I now actually listen to what my patients tell me.
Mm.
And it used to be said that 80% of diagnosis is in the history, not the examination or the test that you do.
Oh,
And
totally.
never a truer word has been spoken, because actually it's even more than that. A lot of the good that you can do and the harm that you can do is in what you say or don't say to patients. So yes, I actually listen. And it's amazing what they'll tell you when you listen.
Mm.
And very often that's the thing that's really that they need fixed, is the thing that they eventually tell you.
Yeah.
Um, and if you don't know that, you'll never get it right. If you don't ask, or if you don't give them the space and the time to say it, you're never going to get it. I'm fortunate because the job that I have is set up in such a way that it allows me physically more time with patients than I would have had before.
Mm.
But definitely my attitude towards them has, yeah, I really feel that I go on that. This is a bit cliche and a bit cheesy, but I do go on that journey with patients, and I do feel what they feel, and I hope that makes me a better doctor and a better advocate for them.
Oh, for sure. Yeah. I mean, because, and I think the GPs and people are under so much pressure as it is in GP surgery that they probably don't have the time to listen, or I don't think they make enough of an effort sometimes to examine the whole picture rather than just the symptoms like here.
Absolutely.
Because I think so many chronic illnesses are misdiagnosed in the first instance.
Absolutely. And it's, the average time to diagnosis of MS, I think, is something between 3 to 4 years.
Really?
This is people who are often presenting to their GP for years and years saying, listen, I've got this weird sensation, I've got this buzzing or tingling or numbness, or my vision's not quite right, or I'm really tired all the time. And yes, these can be symptoms of other conditions. Of course they can. And there's also an element of, yes, it may be psychosomatic, or it may be to do with, essentially all in your head, as some people would say.
Mm-hmm.
But yes, that is incredibly frustrating to feel that you're going time and time again and no one's actually listening to what you're saying.
Yeah. And it's especially the case with fibromyalgia as well. It's because there isn't like a definitive test for that at the moment, is there? It's kind of just eliminating everything else.
Right. It's the sort of collection of symptoms and the time and the way that it's experienced that makes that diagnosis. So, there is no fancy blood test or scan that can be done for fibromyalgia. And there's no single test for MS either. MRI is massively important in that and the gold standard for diagnosis. But
did I read somewhere that there was a new kind of test or something coming out where you can have a type of blood test? I can't remember if it was a blood test or whether it was like you blow into something and it detects it that way.
There's potential for, but the blood test you're talking to is testing for neurofilaments, so little breakdown products of myelin, the fatty covering of some nerves that's affected by MS. And there is a test in clinical trials at the minute, but not available, just yet to patients, where they measure the levels of the neurofilaments in your bloodstream, and it's that may be able to be used to show how effective a treatment is, for example, without maybe putting you through yet another MRI or having to have a lumbar puncture or a spinal tap, which is incredibly unpleasant and painful and not without complications. Which some people would have had to have had, many people. But we are slowly, I'm glad to say, moving away from lumbar punctures as a way of diagnosis because A, MRI is so good at it, and B, hopefully because of research, things like the new blood test may make it obsolete essentially in the future.
Yeah, thank goodness for that as well, because I was so scared when I had my lumbar puncture. The first thing the doctor said was, you need to sign this form in case we mess up something in your back and we just cut off the use of your legs completely.
And that is very rare. But, that is a possibility. A much more common one is a really horrendous post-dural tap headache, which is literally lying completely flat on your back in a dark room for days on end. And that's really, really unpleasant.
It's horrible. It really is. So can we talk a little bit about diet? Because diet is a huge portion of the OMS plan. It's like one of the main pillars, isn't it? The thing that really concerns me with this, and you're probably going to find this really funny, but being a heavily anxious person, the thing that really concerns me about being on a specialised diet is when people invite you to go out to a restaurant or invite you to their house for dinner and things. Like, is it awkward, or are people quite accommodating? Like, can you find things in restaurants and things that you can actually?
Yeah, so no, I don't find that funny at all. I had that fear. Many OMSers at our retreats and our events and online have that same fear and concern.
I'm so glad it's not just me.
No, it's actually one of the real stumbling blocks for some people is that if their lifestyle dictates that they're out for meals and meetings and etc. Sometimes that anxiety can be a real stumbling block for people. So for me personally, and what I tell everybody would be, it sometimes can take a little bit more planning, but it is totally achievable, and you can eat absolutely amazing, delicious food in restaurants with your friends and not have to sit in a bubble in a corner. But there are some things, like some tips, which will be useful. So in terms of cuisines that naturally lend themselves towards OMS style of eating, so OMS, the diet is essentially whole food, plant-based, with or without seafood if you wish. So the cuisines that are really happy, so Japanese obviously would be a really good one. Anything Mediterranean is a good one. So Southern European is your friend. Northern European can be a little bit difficult because it's very dairy reliant. as I found when I went on holiday to France. I think they found it in fact, they found it offensive that I didn't like milk and cheese anymore. But so Mediterranean food, Spanish food, Portuguese food is absolutely perfect. Italian food, brilliant. And my go-to in a lot of restaurants would be pizza, because an OMS-friendly pizza is often just take off the cheese, which is brilliant because you can eat more pizza if you don't have the cheese filling you up.
Oh, but that's the best part.
No, I used to say it all the time. I can speak to authority, Jesse, because I was the biggest dairy eater in the world. I ate huge amounts of cheese. I loved milk, loads of yogurt, mainly the cheese. Though loved cheese, and I was a massive carnivore. I had loads of steak, meat, and everything, and cheese on top. And I haven't touched either of those for 4 years, and I haven't looked back. I promise you, I have not looked back. Yeah. And if I didn't have MS tomorrow, I would not go back to the way I used to eat. And I promise you that. I feel so much better from so many different ways from the diet. Obviously, I hope it's helping my MS, but, I lost 2 stone in weight. I no longer have any of the sort of tummy symptoms I used to have. I used to have a lot of sort of indigestion and heartburn symptoms. I have none of that. And I just feel, lighter and cleaner and healthier. So that was my motivation for doing it, I'd say. But going back to your question about restaurants and diets and eating out and things. So restaurants, those sorts of cuisines are really helpful. And naturally, most of them, there's something on the menu that would be appropriate or could be easily adapted. Mm-hmm. But sometimes it's just a question of phoning ahead would always be one that I would do if I can. If I know it's a big dinner, if it's a big work thing or a family occasion or something, I'll usually phone or email the restaurant themselves directly and say, listen, essentially, I don't eat meat and dairy. I try to eat a whole food, plant-based diet, but I really like fish. Is there something they could do? And overwhelmingly, Jesse, to be honest, it's a yes, and it's really positive. So, I remember one year on our wedding anniversary, we went out for dinner, and I'd emailed ahead and I explained. The waiter came out and he said, chefs, just if you're okay with eating everything else that you can't eat, if there's anything you don't like, please tell me. But otherwise, we're not going to give you a menu. We're just going to make you a few courses with what's fresh. And it was the best meal I've ever had. And it wasn't a massively expensive restaurant. And they actually ended up putting one of the dishes onto their regular menu because they liked it so much. So yes, you can get around the restaurant thing. And it does become easier with practice and experience. Fast food can be tricky because, well, fast food is not designed really for anybody to eat if they want to be healthy. But it can be difficult. I make sure I never go hungry because I do get really irritable if I am hungry. So I'll always have either some dried fruit or some nuts with me in a packet, or I'm a big fan of naked bars. Most of them are perfectly acceptable in the OMS program, or breadsticks and hummus, my go-to snack from out and about, those sorts of things. When it comes to eating at friends' houses and having people over for food, I now love to show off. So we'll cook an OMS friendly meal for them, and nearly always they say, "Wow, this is actually." They always say "actually" as if they're surprised. This is actually really good. It's really tasty. I could maybe do
say that.
Yeah. Actually, this isn't that bad. As if it's going to taste like ditch water. And actually, then when I go round to people's houses, I would usually bring something, just partly selfishly as maybe a backup plan for me. But also to let other people try it. And do you know what? I love this lifestyle. I love the food. I love the food that I eat. It's so much more enjoyable and colourful and tasty than the processed nonsense I used to eat 3 times a day for many, many years. So, no, if that's the fear of going OMS food-wise, don't let it hold you back, because once you do it, you won't look back. And as I said, I wouldn't change it now tomorrow.
Yeah, that's really good to know. So thank you so much for that, because I think for a lot of people that is the kind of the main option. Like you say, it's like, well, how am I going to negotiate that in other places and stuff?
And we have loads of tips and hints and things like that. But the take-home message is, once you get your new routine, it becomes very easy. I don't think about it every day. It's not a problem. When I go into a restaurant, if I'm looking at a menu, you become like the Terminator. So you or cannot eat, will not eat, don't like this, and you zoom in on the things you can eat. And it's like any habit. They usually say it takes about 66 days to form a new habit.
Yes.
And the odd slip up doesn't really matter in the long run as to how you're going to keep on it. Mm-hmm. And now it's not a habit. It's not a lifestyle choice. It's just the way that I live and eat, and that's it.
It's just normal. Yeah.
second nature. It's like breathing. It's just how I do things now.
So similarly as well with exercise. Exercise is another important pillar in your MS program.
Absolutely.
And I was quite interested to read that you were a keen cyclist before MS. And then when you got MS, you kind of decided, actually, that's not the best thing for me to do, so I'm going to start running. And now you've gone back to cycling again.
Yeah.
Fascinating.
Yeah. So MS decided I shouldn't be cycling. The dizziness and the balance would have made cycling a little bit interesting, I think, for me and for anybody on the road. Yeah, you're absolutely right. So when I was at university, I used to do quite a lot of cycling, and I cycled around Ireland actually one summer with a friend to raise money for a cancer charity. So I've done a bit of cycling before, nothing ever at any competitive level, but just for enjoyment. And then with the balance, I stopped, and I needed to do something for my mental health, something proactive to show that I could still do things when I felt physically, not as strong as I had.
Yeah.
And also I wanted to raise money, and I wanted a goal to aim at. So, and believe me, I am not a runner. I still am not a runner. I still hate it. I don't really see the point, to be honest. But, and it's given me lots of problems with hips and piriformis syndrome and all sorts of things. But,
okay.
Yeah, but it got me out there, and I went for a 5K and then a 10K and a half marathon, and I raised lots of money for OMS, and that was great. And I had, a target to aim for and something to achieve, and that was fantastic. But I knew that the hip thing was just not great fun, and so I went back to cycling. My balance had got much better. I did a lot of neurophysiotherapy and balance exercises and the funny eye exercises that you do, and got things back on track. And I felt, I could try this again. We'd moved to the north coast of Northern Ireland from Belfast, which is like any big city. It has its nice bits and its not so nice bits. The north coast is just absolutely beautiful. We live essentially on a farm surrounded by fields. We're 3 miles from the coast, so the cycling here is so beautiful, and it's much safer because there's much less traffic. So I thought, well, I really want to get back into this. So I started again in May time, and my biggest issue now is it's not that my legs aren't strong enough. It's my back gets too sore when I'm cycling. And I don't know if that's just because I'm getting old, or I need some more yoga or Pilates in my life. So I'm going to go down the yoga Pilates option a bit more, and hopefully iron out the kinks in the back and go on from there, because I really love it. Yeah.
Awesome. That's really great. I mean, there's a lot of doctors that say, or used to say, should I say, their advice was to kind of not exercise in case you have relapse and all of this sort of stuff.
Yeah.
Actually, my neurologist told me, and I heard that too. We had Dr. Gretchen come on not so long ago, and she said, "Oh no, that's really old advice. Like, you have to exercise now. It's like as important as DMDs almost."
Absolutely. There's good evidence now that it's exercise. It has benefits in so many aspects of your general health without MS, but in MS specifically, it has amazing benefits for sort of things. Neuroprotection, so protecting your brain, growing new brain cells, neuroplasticity, which is the essentially rewiring around damaged areas of the brain. All of these things, and I remember reading somewhere that there's 2 proteins that are, I can't remember the names of, that are released in your brain when you exercise. And the analogy that the authors use is it's like pouring Miracle Grow on your garden. Wow. So whenever it's a really hard hill, and I'm hating the cycling, I'm thinking, it's Miracle Grow. And of course there's the massive positive effects on your mood as well, of exercise, and the really clear benefits of that. But you're absolutely right. A lot of neurologists now consider exercise formal prescription exercise as important as any one DMD in terms of long-term progression of the disease, perhaps, although it's not fully understood yet. But in terms of quality of life and relapse rates, absolutely, there's pretty clear benefits of exercise now.
Totally. No, I think it's amazing. So everybody, listen up, go and try exercise. I know it's hard. Because you're so fatigued, and it's hard. But
and the weird thing about fatigue is that the studies would now show that actually doing little and often and incrementally, slowly increasing that actually improves your fatigue. So that's very important to say, although it can seem like the last thing you want to do at the time. And the other thing is that a lot of people with MS find exercise difficult because of the heat. So when their body temperature rises, their fatigue gets worse, or their old symptoms come back, and that's called Utzhoff's phenomenon. And that's actually how they used to diagnose MS, by putting people in really hot baths to see if there's symptoms.
I didn't know that.
not sure if that's better or worse than an MRI scan, but anyway, that's how
Wow,
they do it.
that's for another day.
Yeah, absolutely. But you know, the heat and the impact it has on your fatigue or symptoms can be a really big barrier. But there are ways around that. So for some
Yeah.
people, cooling vests or ice baths, for example, it might be swimming as their way of getting aerobic exercise because that regulates your temperature better than running or cycling would, for example.
Yeah.
Or it might be that you do strength resistance training rather than endurance training. So the strength training, weights and TRX and those sorts of things don't to increase your body temperature as much as, say, running or cycling would. And that's the way around it for some people. And usually our message at OMS is no matter what your level of ability or disability, there's nearly always something that you can do exercise-wise that we know can improve your quality of life and many of your symptoms.
Yeah, definitely. So we have a couple of I can never say this word, gynecology related questions from our Enabled Warriors group on Facebook.
Yeah.
So we have firstly from Gina Johnson.
Okay.
She asks, many women have heavy bleeding after a child, and their options are a hysterectomy, medication, or an IUD. She says she'd love to know more about this. Is there a reason why that this is, and is there anything that women can do organically?
Yeah, so that's a really, really good question. You're quite right. For many people, their menstrual cycle does change after they have a baby. And there's probably a few reasons for that. It could just be that the actual architecture, the shape of the womb has changed. The stretching that the baby has resulted in has caused a change essentially in the lining of the womb that can be enough to cause a change in their periods. It could be that as you're more likely to have a change in your menstrual cycle due to hormonal change, and also there are some structural things that can develop inside the womb that can cause a change in the bleeding. So, for example, polyps or fibroids would be two common causes. So that's sort of why it happens. With regards to what you can do about it, absolutely, there are so many more options than there used to be. It used to be the real treatment was just a hysterectomy, but hysterectomy is very very rarely done for period problems per se, and in fact it's advised now that it's not considered right at the bottom of the list before it mustn't be considered really until you've tried lots of other things. So yes, there are the hormonal pills, the mini pill or the combined pill. There are the injections and things that you can use, or the little implants that can reduce the amount of bleeding, although it can make it more irregular, so it can cause different problems. The IUD, so the Mirena coil, is extremely effective at treating bleeding problems. About 85% of people who use it for that will find that they either have no bleeding or much lighter bleeding. So it's very effective, and for that reason, we're doing many less hysterectomies because we don't need to. There's also another treatment, you can actually burn the lining of the womb directly as a way of treating it, and that's also very successful. So there's many more options medically than there used to be to treat it. So hysterectomy is right at the bottom of the list now. Yeah. In terms of what you could do to treat it naturally or organically, it's hard to say because the levels of evidence aren't as high as for the medical treatments, which is often what you find with lifestyle-based interventions. But some key things that would be really important: making sure you're getting enough iron. So if your bleeding is heavier, you're likely to be losing more iron with each cycle, and you could be potentially developing anemia. So making sure you get enough iron, whether that be through your dietary sources. So meats would be the typical sources of that, but you don't need to eat meat to get iron in your diet, would be a very strong OMS message. Many of the green leafy vegetables are very high in it, and many of the beans and pulses and legumes too. So that, or even a supplement of iron if required. And also vitamin C is really important in regulating bleeding and clotting. So that's a really important thing to have as well. There's some evidence about ginger and ginger root. With regards to reducing bleeding, there's a small study from Iran that showed that it was of benefit and made periods much lighter. But what I would usually advise is that if you have any concerns about your periods or changes in your cycle or worrying new symptoms, that you should really just first instance speak to your GP and take their advice and see if any further investigation is needed.
Yeah, definitely. Always consult your GP, guys. Always.
Absolutely.
Super important. So Sophie Brody got in touch as well, and she said, what should I consider as someone recently diagnosed with MS who wants to have children in the future? Now, this question comes up a lot in the Enabled Warriors group. So she says, in terms of treatment, supplements, diet and exercise, like this stuff to discuss with a partner. So what should she consider?
Yeah, so that's a massive question, really, isn't it?
It is a massive question.
And of course it is, and rightly so, because almost 3 times as many women as men are diagnosed with MS. It's at a time in their lives, usually in the 20s to 40s, when they're thinking about starting a family and having children or more children. And there's so many things, the illness itself, what happens if it progresses? Will I be able to look after children? What if I start different treatment options? How will that impact? So it's an absolutely massive issue. Yeah. And it comes up in lots of the work that I do all the time. So the things that are really important to remember, first of all, if pregnancy is right for you, then it's probably not the MS that should stop you. Okay. Mm-hmm. It used to be this horrible paternalistic thing, oh, you shouldn't really have children, you have MS, without any basis at all. Because in fact, from a scientific point of view, we know that it significantly improves MS symptoms and relapse rates while you're pregnant because it turns down the immune system. And we think in the long term that pregnancy has a positive impact on this disease. So there's a lot to be gained there. Breastfeeding, as an aside, incredibly important if it's right for you, because we know not only will the breastfeeding protect you from an MS relapse after the pregnancy, but it also reduces the risk of your child getting MS by 50% if you breastfeed for 6 months. I mean, that's massive. And that's something that lots of women can do with the right support. Mm-hmm. With regards to diet, if somebody's following the OMS diet, for example, there is no concern. People always get concerned that they suddenly need meat during pregnancy or that they have to start taking milk again. No, that's absolutely not correct. In fact, the guidance from many of the bodies in obstetrics and gynaecology is a diet not far off a whole food plant-based diet. Yes, you do need to be careful that your iron levels don't drop. You do need to make sure your calcium levels are high enough, but there are many plant-based and whole food sources of that, so you don't need to worry about meat. So, the take-home message about pregnancy, by the way, is it's not eating for two. It's probably no, sorry, it's not true at all. It's probably at term you need an extra 200 calories a day, and that's it. So that's like a digestive biscuit. So you don't need to eat for two. You do need to be really careful about your vitamin D in pregnancy. So in somebody who is pregnant and has MS, vitamin D is extra important. So not only is there the impact on your MS, as your vitamin D level will naturally drop in pregnancy, but there's also the pregnancy itself to consider. So we know that if you're vitamin D deficient, it triples your risk of miscarriage. So it's really important. And also vitamin D levels seem to be really important during the pregnancy in terms of protecting the baby from preeclampsia, a condition of blood pressure in the pregnancy. And there's some evidence about growth and actually about bone growth as well. So vitamin D is a massive one. If you love exercise is great. There's no reason to stop exercising in pregnancy. You may have to adjust things slightly, and obviously we wouldn't advise being a black belt in karate or judo or something and taking abdominal trauma on a regular basis. But generally, if it's yoga or running or cycling or something like that, there's absolutely no reason that you can't continue to do that in the pregnancy itself.
That's brilliant. Just going back to the vitamin D really quick, what would you recommend as a kind of daily sort of amount to have? What would be the best?
So the OMS advice, which I follow, is that we would say if somebody has MS, they should usually be taking between 5,000 to 10,000 units of vitamin D3 on a daily basis, aiming for a blood level of 150 to 225 nanomoles per litre, which is the unit we use in the UK. It's slightly different if you're in the United States. And yeah, if you're somewhere like Australia, New Zealand in the summertime, because even our summers aren't, as we all know, in the UK are not that good, you could probably get that vitamin D through 10 to 15 minutes of direct sunlight 3 to 5 times a week. But for most people, and certainly those of your listeners in the UK, especially over the winter time, that's going to be 5,000 to 10,000 units a day.
Okay, that's great. Yeah.
The important thing about vitamin D, just to say, is it's fat soluble, so it's absorbed with fat in your diet. So taking it on an empty stomach means you do not really absorb very much of it. So it's important just to take it with a meal or after a meal.
Good advice. Good advice. And in terms of fat and things, so how is that covered in the OMS programs? I know they tell you to not eat like oil and things like that. Yeah,
so you mean generally, not specifically to pregnancy, but generally OMS?
It's just generally.
So generally, the evidence as we see it is very clear that levels of saturated fat in the diet. So that's the hard fat on your plate, the rind on a bit of bacon or chop, for example, mainly from animal sources, is very clearly linked to developing MS, but also in how severe it is and its progression. And we think the evidence for that is very clear, and the evidence behind that is increasing all the time. So that's the number one thing to avoid. So it's the animal fats. You then want to avoid the tropical fats, the coconut or the palm fats, because they tend to be very high in saturated fats as well. And the other thing that you really want to avoid are processed oils. So when you go into a shop and it says vegetable oil, that means it could be anything. It can be treated at any temperature, any number of artificial compounds in it, any mix of different fats. So we try to avoid things that aren't named, but named oils, especially things like extra virgin olive oil, is a really good balance of fats. Flax oil, which we advise you supplement with daily, is extremely high in omega-3. But the problem with it is you can't cook with it, you can't heat it because it's very fragile, unstable oil. So you've got to keep it cold, got to keep it dark. So it's good for putting in a smoothie or on your toast or in a dressing, but don't cook with it. And other things like rapeseed oil are quite high in omega-3, and provided they're from good sources, absolutely fine. But it's the unnamed ones and the saturated ones that we really, really advocate avoiding with the OMS program.
Awesome, good to know. So before we get onto the super quick secrets round, what advice would you give to people who are newly diagnosed? And what advice would you give them?
It's really hard because this is an incredibly individual process, and it is grieving, and it's not a straight line, and for some people that road will go other directions from others. But my own take on this was that information is power and is key, and burying your head in the sand is not going to give you the good long-term outcome that we all hope and wish for. Getting reliable sources of information early on is really, really important. And for us, there's so many sources online. We're very lucky now. There's podcasts, as you can tell, and there's social media sources and lots of advocates for the condition. There's lots of reliable sources on our website, for example, or the MS Society or MS Trust. So information is key, because there's a lot of myths about MS out there. A lot of them that are not true. And confronting that demon or dragon early on could just make such a difference. But the other thing that I found was support. Trusted friends. There are people in my life that are closer to me now than they were before MS because of the way that they helped me through. And it wasn't because I'd chosen them, but naturally we've gravitated towards each other. And finding that support is the most important bit of this. Really, I was so lucky that my wife was 100% on board with all my decisions and my choices, and was being there every step of the way, as of many of my family members and so many of my friends. And being open about it early on. I remember when I first got involved with OMS through a friend in Belfast, he said, are you out about your MS? As if it was coming out of the closet about being gay, for example. And I said, well, yes, I've always been open and honest about my MS. And this is a friend who had hidden his diagnosis for 5 years from everybody. And that weight, it must just be crippling. And I'm not saying anybody must tell people, because that can be incredibly difficult, but do consider the potential positives by being open about it, because you'll be amazed the people that are there to help you when they know that.
Yeah, definitely. And also don't be kind of shocked if some people actually move away from you, and don't try to pull them back. Just let them go.
Absolutely.
You can't have people like that around you.
No, do you need someone like that in your life? I'm not sure. There are people that I know have sort of naturally fallen away from me, maybe because of MS and how I've responded to it and the way that I've changed my life. And well, unfortunately, that's their problem. As I once heard said, what other people think of you is none of your business.
Totally.
I'm doing this for me, and for people I care about. So if you don't like it, tough, really. That's my view.
Exactly. Exactly. So, are you ready for some super quick secrets?
Yes, okay, go for it.
I know you're can't wait for this round. So,
yeah. Right.
So, okay, Enabled Warriors, we've talked about some heavy stuff today. Let's have a little bit of fun before we go. This is the part of the show where we find out a little bit more about the personality of our guest. Some super quick secrets. Are you ready for this, Jonny?
I am ready. Let's go.
Okay, most inspiring book that you've ever read?
I've got to be honest, it's got to be George Jellinek, Overcoming Multiple Sclerosis. And I would say that, but it literally changed my life. But can I also add a couple of just my favourite books really quick because I love them?
Go for it.
Yeah, so Animal Farm, I think is absolutely amazing. Picture of Dorian Gray, absolutely class. And Lord of the Rings, love them all.
Awesome. That's awesome. And you can actually go and get the OMS book for free if you are in, what was it? UK and America, was it? Was it ever?
Yeah, and also in Australia and New Zealand, there's a scheme there too where it's free. Absolutely.
Awesome. Okay, what is the weirdest thing that you've ever done?
Definitely got to be something gross and gynae related.
Perfect. Go for it.
Except that it's very common for people after childbirth to have prolapse, so their womb starts to come down. That can cause really horrible symptoms. There are lots of treatments for it. This particular lady who lived in rural Canada had chosen to use potato as her form of treatment for it, and it had taken root and started to grow in a place that you wouldn't normally find a potato, and that's all I can say about it.
Wow, that's fascinating.
That was pretty weird. Yeah.
That's fascinating. I mean, you must have so many stories like that.
Yeah, I haven't. But I can't tell them to polite audiences.
No, it's fine. So
and also never break confidentiality as well.
Sorry, just say that again.
I would never break confidentiality either, so there's no names or places involved.
Amazing. What is your most favourite place that you've ever visited? Wow, my words messed up totally there.
Yeah, so my favourite place I've ever visited, I can't pick between two. One is South Africa and one is New Zealand, both of which are just amazing countries that I was lucky enough to spend some time in. And I just can't separate them. I could live in either one if I was allowed to, if it would work.
What would you say is the scariest thing that you've ever done?
Without a shadow of a doubt, great white shark diving into Africa.
Oh my gosh.
Yeah, that was mental. I would never do that again. I was young and stupid. That's truly terrifying. Touching a shark is a very exhilarating experience, but it's not one I would do again.
Oh wow. Okay. Where can other warriors find out more about you and what you do?
Moving on from sharks. The Overcoming MS website, www.overcomingms.org is the first place. There's lots of information about me, obviously, but more importantly, the program, lots of resources. I am on Twitter as, which one is it? At Jonty303, JONTY303, and on Instagram I am JonnyWhite1234.
Awesome. So warriors, please go and connect with Jonny because he's amazing. So thank you so much for coming on the show today. We have learned so much from you and I'm so grateful to have spent some time with you today. So remember warriors, please go and check in with Jonny on his social media channels. I'll link them all in the show notes above anyway, so you can go and click on those. Remember warriors, stay enabled. Thanks Jonny. See you soon.
Thank you very much, Jessie. Thank you.
If you want to fight back against your invisible illness and help take the dis out of disability, then join the tribe on Facebook, facebook.com/enabledwarriors. If you love this podcast, click that subscribe button and never miss another episode. And remember warriors, stay enabled.